According to Medical Daily, Colorado is now considering a state-run, universal, single-payer healthcare system. They say, quote, the grassroots support group, ColoradoCareYES, presented 158,831 signatures sponsoring a proposed overhaul, and that's enough to get a direct vote on it through a ballot initiative. Quote, the proposal would fund itself through a new 10% payroll deduction. Employers would pay about 7% of the tax, while employees would cover the rest. In exchange, people would no longer need to pay individual premiums. Well, that sounds fucking lovely. Deductibles or most copays would also not exist anymore. Well, that sounds fucking lovely. Though people would still choose their own medical providers, and their bills would be paid by the state itself, creating what the group calls Medicare for All. All right, so let's pause here. Guys, what they're calling for is only a version of what almost every other modern nation has in the world. Think about that. And naturally, they're going to be maligned as being extremists when the real extremist position is what we have all around the country. The private health insurance system, which is a fucking scandal. Okay, this thing is... I mean, if you really wanted to, if the media covered things that actually mattered in a serious way, they would lead every night with how fucked up our healthcare system is. Our health insurance system and our healthcare system. It's a joke. We pay more than everybody else and we get worse outcomes. 45,000 people die every year because they don't have access to basic healthcare. Millions of people uninsured, even with Obamacare in place. Obamacare was a step in the right direction, but it's the equivalent of putting a Band-Aid with ointment over a gaping gangrenous wound. Here you have people in Colorado saying, well, how about we do our own Medicare system at the state level? Not even like remember the Romney plan in Massachusetts? That was like Obamacare, an individual mandate at the state level. This would be a single-payer system at the state level. So instead of you having to pay premiums out of your pocket and co-pays, and then you still have to pay a shitload when something happens to you, they're saying, how about we fund it via taxes and you don't have to pay anything when you get in trouble? Radical idea. Instead of your taxes going to stupid shit, your taxes goes to, this system where if you get hurt, you get help. You wacky communist, you. They say, according to them, savings would come from reducing administrative costs as well as allowing the negotiation of bulk rates for pharmaceuticals. It's claimed these savings will amount to about $5 billion when compared to what Colorado citizens currently pay collectively. So that's important too, because some people will tell you, well, we can't afford it. That's the go-to. Come on, can't afford it. Bankrupt the nation, can't afford it. Healthcare, can't afford it. War with 7 countries in the Middle East, can afford it. Don't even question it, just do it. Healthcare for people, can't afford it. Can't afford it. No, they're saying right here at the state level they're going to save about $5 billion. What now? So if anything, we can't afford the system we have right now. We can't afford the private system. Why does anybody ever say that? Oh, the private system? Can't afford it. I can't afford it. Just can't afford the private system. Got to go to a socialized system. Can't afford the private system. Because that actually is true. Like I told you, we pay way more per capita than any other modern nation and we get worse outcomes. So why doesn't anybody ever say from a fiscally conservative perspective, well, we can't afford the private system. Can't afford the capitalist system anymore. It's fucking everybody up. Costs too much. Worse outcomes. Can't afford it. Can't afford it. Can't afford it. Nobody ever uses that argument. Well, they're using that argument. They're like, actually, we'd save $5 billion if we switch to the system that we want, if we switch to a single-payer system. And a lot of the savings, they say, it comes from allowing the state to negotiate with pharmaceutical companies for the rates for their products. Now, you're probably thinking, well, wait, that's weird. Shouldn't that already be the case? That's right. It should be, but it's not. Because the pharmaceutical companies have such a stranglehold on the federal government that even under Democratic administrations, Obama allows them to not have to negotiate. So, in other words, the government pays whatever the pharmaceutical companies say they should pay, and there's no negotiation. So, that's one of the many reasons why we're paying much more for basic health care. Because a lot of the pharmaceuticals that we use, a lot of the products that we need to use, they charge you an arm and a leg for it. You're not even allowed to negotiate. Isn't that incredible? And here, Colorado's saying, well, how about we do the opposite? How about we act like every other modern nation and we say, of course we're going to negotiate for our prices. What are we, fucking crazy? And they're going to save money. This is such a no-brainer. It's amazing. Now, here are the reservations on this, though. Vermont successfully passed legislation about 3 years ago to do the same thing, but it was scrapped. They say, quote, it was determined that the short-term costs were too high of a burden on the economy. So it's not a sure thing, but it's a start here. Now, that That scares me because what that tells me, and I don't know that this is true as a matter of fact, I've read no articles that go into details on this, but what that tells me is when a state tries to do it, the powers that be will crush them. So all of the insurance companies, the pharmaceutical companies, the suppliers, they all basically, they see the writing on the wall when something like this happens, and they know that this can spread, and then eventually you have 12 states that have a single payer system at the state level, and then next, 32 states, and then boom, we get it at a federal level or something like that. They see that coming. So since they see that coming, they'll spend they'll hit you with everything they got up front to kneecap it so that nobody could do it, and they'll just keep making the argument, it's impossible to do. Look, it failed in Vermont. That's what they're trying to do here. And Vermont said, hey, in the short run, it's going to be too expensive. Why do you think that is? Now, my guess is that, again, the powers that be said, oh, you want to do a single-payer system? Fine. Well, and then they just fucked with them. And they said, okay, medical supplies for a year are going to cost 10 times more than anybody else because we're going to punish you for going over to this system. Stuff like that, which makes it so that it's unworkable because you're functioning in a system that's so immensely corrupt that, it's like trying to be the one business on the block that doesn't pay your dues to the mafia. When everybody else is paying their dues to the mafia, and you say, I'm not going to fucking do it, it's much more likely you'll end up dead in a ditch than you're standing on principle and actually sticking to that, and then the mafia folds. They're not going to fold, they're the fucking mafia. Well, that's what the private insurance companies are. That's what the pharmaceutical companies are. So, God damn it, Colorado is right, and they're so right, and I hope they get this, and I hope that there's movement on a national level to protect them, and I hope that other states do this. And in reality, I actually don't even hope that this happens on a state-by-state basis. I hope we get Medicare for all at a federal level. It was the right plan from day one. It should have been done from day one. The only real arguments against it are, well, it'll be a hard transition over. It'll be a long and hard transition over. That's true. It will be. And there's so many people that honestly have useless jobs today that are going to lose their jobs. I mean, there's paper pushers at insurance companies and pharmaceutical companies that are going to lose their jobs because they don't actually do anything of substance for the economy. Their job is to weasel people out of money when they shouldn't. So yeah, there is going to be an increase in unemployment, specifically in this field. You are going to shake up the system big time, but so be it, man. I mean, when you had to shut down Stalin's labor camps, some people lost their jobs, of course, the people who were working at the labor camps. Should I cry tears for them? No, of course not. Get them a new job. That system shouldn't exist in the first place. The same way that a health insurance system and a health care system that profits off of misery, that has a perverse incentive to deny care to make more money to pad the bottom line for their shareholders. Well, that system shouldn't exist in the first place. So I'm not going to stick by it because, it's practical because we've been doing it for so long. Well, they did Stalin's prison camps for a while too. Does that mean, keep it going? They've been here for so long. That's not an argument. That's a stupid point. Okay, so I hope they win. I hope they crush it. And I hope that this movement spreads.